Welcome to the deep dive. Today we're tackling a topic that, well, it might be lurking in our dogs and cats more often than you'd think. Gallstones.
That's right. Cholelithiasis, technically.
Right. And it can be totally silent, cause no issues,
hmm
or it can cause some pretty serious problems. So let's get into it.
Exactly. We're looking at cholelithiasis. These are basically stones or calculi that form in the bile ducts, gallbladder, or sometimes even inside the liver itself, though that's rarer.
Okay.
And we should also mention gallbladder mucoceles, GBM. It's related, kind of a different beast, but often discussed alongside gallstone.
Right. We'll circle back to that. But the gallstones themselves,
Yeah.
what's really surprising is how much the symptoms can vary, isn't it?
It really is. You can have an animal walking around completely fine, no clue they even have them.
Totally asymptomatic.
And then you have others that are really quite sick. Usually that's when a stone causes a blockage, stopping the bile flow, maybe leading to infection or inflammation.
So our mission today, using the info we've gathered on cholelithiasis, is to figure out, well, what are these things actually made of?
Uh-huh.
Who tends to get them? How do vets even find them? And critically, what can actually be done about it?
Sounds like a plan.
Okay, let's unpack the stones themselves. What are the building blocks in dogs and cats? Is it like human gallstones?
That's a great question, and it's actually quite different. The main stuff we see is mucin. That's a kind of slippery glycoprotein
Okay.
mixed with calcium carbonate and bilirubin pigments.
Bilirubin from red blood cell breakdown.
Exactly. Now, here's a really key difference from humans. Dog bile usually has much lower cholesterol saturation.
Ah, okay. So fewer cholesterol stones like you hear about in people.
Generally, yes. But dogs have their own issue. They're more likely to develop this bilirubinate sludge, especially if they've been fasting for a while, or if their diet is low in protein and an amino acid called methionine.
Hmm. Interesting dietary link there.
Yeah.
What about cats? Are they the same?
Cats are different again. This is fascinating. Around half of feline gallstones contain calcium carbonate.
50%. Wow, that's high. So they're more mineralized, like little pebbles,
Pretty much. And that high calcium content means they're more likely to be radiopaque.
meaning they might actually show up on a standard X-ray.
Exactly. Unlike many dog stones or sludge, so that's a useful diagnostic clue sometimes in cats.
Okay, so composition varies. Now, who are the usual suspects? Any particular breeds or types of pets more prone to this?
Broadly, it affects both species, cats and dogs.
Right.
But the information does suggest that maybe small breed dogs could be a bit predisposed.
Okay, little dogs might be more at risk. Anything else?
Yes, particularly in dogs, there seems to be this connection between hyperlipidemia, that's high levels of fats, lipids in the blood.
Like high cholesterol?
Yeah, cholesterol and triglycerides. There's a link between that and developing gallbladder, mucosal, GBM, that related condition.
Got it. So small breeds, dogs with high blood fats.
Mm-hmm.
Things to note. Now, if an animal does have these stones, what might an owner actually see, assuming they're not one of the asymptomatic ones?
Right, because many show no signs at all. But if they do become symptomatic, it's usually linked to issues like, well, sludged bile causing irritation or a blockage of the main bile duct outside the liver.
The EHBDO you mentioned.
Exactly, extrahepatic bile duct obstruction. Or it could be inflammation of the gallbladder cholecystitis or inflammation of the bile ducts within the liver, cholangitis, or even the really serious one, bile peritonitis, if things rupture.
Okay, those sound quite severe. What are the actual outward signs an owner might notice?
You might see things like vomiting, maybe seeming uncomfortable or painful after eating,
Meal-related discomfort, yeah.
general abdominal pain, maybe a fever if there's infection, and potentially jaundice, that yellowing of the skin, gums, whites of the eyes.
Okay.
And sometimes it's more subtle, maybe just vague episodic belly pain that seems to crop up after meals and then fades away.
So even subtle signs after eating could be a clue, potentially. Among other possibilities, of course.
Of course.
Let's dig into the why. What actually causes these stones to form? What kicks off the whole process?
There are several predisposing factors we need to consider. A big one is bile spaces, basically. The bile isn't flowing properly, it's sitting around too long.
Makes sense.
Yeah.
Why might that happen?
It could be due to the gallbladder not contracting effectively. We call that gallbladder dysmotility. Or, particularly in cats, something called choledocholithiasis, which are these odd fluid-filled sacs on the bile duct, can impede flow.
Okay, so poor flow is one factor. What else?
Then there's the idea of lithnitis. Think of it like a tiny seed crystal.
A starting point for the stone.
Exactly. This seed could be inflammatory debris, bacteria from an infection, maybe even cells shed from the lining of the ducts, a tumor, or, interestingly, even leftover suture material from a previous surgery in the area.
Wow, suture material. Okay. What else?
Bile supersaturation.
Suture saturation, meaning there's too much of something dissolved in the bile.
Precisely, like adding too much sugar to your tea, eventually it stops dissolving and settles out.
Gotcha.
So, if there are high concentrations of things like those heme bilirubin pigments, maybe from bleeding into the biliary system called hemophilia or excess calcium, or increased mucin production.
Which you said inflammation can trigger.
Yes, inflammation or certain hormones like prostaglandins can increase mucin. Even cholesterol, though less common as the main component in dogs, can contribute if levels are high enough. When these things get too concentrated, they can start to crystallize and clump together.
Okay, so slow flow, a starting point, and too much stuff in the bile. You mentioned something specific about cat anatomy earlier, too.
Ah, yes, this is really key for cats. They have this unique setup where the main pancreatic duct and the common bile duct fuse together just before they enter the small intestine at a spot called the ampulla of Vater.
A shared exit route.
Exactly. And this shared pathway makes them, unfortunately, more susceptible to concurrent problems. Issues in the biliary system, like stones or inflammation or stasis leading to that EHBDO, can easily affect the pancreas, causing pancreatitis and vice versa.
Wow, yeah, that sounds like a recipe for trouble in that area. What about the sludge itself? Does that make things worse?
It absolutely can. Both bile sludge and having a gallbladder that's overly stretched or distended can actually stimulate the gallbladder lining to produce more mucin.
Oh, so it feeds back on itself, a vicious cycle.
It's like a snowball effect, yeah.
Yeah.
More mucin makes the bile thicker, more likely to sludge, potentially helping tiny particles stick together to form stones.
Right.
And then you have inflammatory mediators, chemicals released during inflammation, and enzymes produced by bacteria, especially if there's cholecystitis. These can also promote stone formation by altering the bile chemistry.
Okay. And the diet factor in dogs again.
Can't forget that. As we touched on, those diets low in protein, low in taurine, and low in methionine seem to increase the risk for dogs, so multiple hits often needed.
A complex picture. So if a vet suspects gallstones based on signs or risk factors, how do they actually confirm it? What's the diagnostic process?
Well, first they'll think about other things that cause similar signs, the differential diagnoses. This includes other causes of EHBDO, cholangiohepatitis without stones, cholecystis, cholangitis on their own, pancreatitis, bioperitonitis, and that gallbladder mucocele GBM.
So rule out other possibilities. What about basic tests like blood work and urine?
They can be a bit tricky. Often, standard blood counts and biochemistry panels and urinalysis might be completely normal, especially if the pet isn't showing signs. But they can give clues if there are complications. You might see signs of infection, or if there's a significant bile duct obstruction, you'll often see changes.
Like what?
In symptomatic cases, you might get variable increases in bilirubin in the blood causing the jaundice, and typically elevations in liver enzymes, things like ALP, alkaline phosphatase, GGT, gamma-glutamyl-transferase, and often ALT and AST as well.
Okay, so elevated liver enzymes are a definite flag. Any other lab tests?
Yes, getting a sample of the bile for bacterial culture is really important, especially if the animal is sick. It helps identify if infection is playing a role and which antibiotics might work. You can culture both aerobic and anaerobic bacteria.
Makes sense.
And if surgery happens and stones are removed, culturing the nidus, the very center of the stone, can sometimes pinpoint an originating infection. We also need to think about clotting.
Clotting, why?
With chronic EHBDO, the blockage can interfere with vitamin K absorption, which is crucial for blood clotting. So checking coagulation profiles PT and PTT is important. If they're prolonged, the animal likely needs vitamin K1 therapy, usually given by injection.
Oh, okay. And analyzing the stones themselves.
Definitely. If stones are removed, sending them to a special lab for analysis tells you the exact makeup. Is it mostly calcium, carbonate, mucin, bilirubinate pigments? It helps understand the why a bit better. It's like gallstone forensics.
Okay, so labs help. What about actually seeing them? Imaging must be key.
Absolutely. Standard x-rays or radiography have some limitations, though.
Oh, why is that?
Many gallstones, especially in dogs, are small and radiolucent, meaning X-rays pass right through them. They don't show up well.
You might see those calcified ones in cats we talked about. Occasionally, you can see mineralization in the bile ducts due to chronic inflammation, but it can be hard to distinguish from stones sometimes.
So x-rays aren't the go-to then. What is ultrasound?
Ultrasound is generally much more useful. It's great for this.
How so?
It can detect stones, even small ones down to about 2 millimeters. It can show if the gallbladder wall is thickened, if the bile ducts are dilated, suggesting backup. It can reveal changes in the liver tissue itself, signs of inflammation, fatty changes, fibrosis.
Wow, okay.
Ultrasound can also help spot issues in the ducts outside the liver and, crucially, can guide needles to safely collect samples of bile or tissue for culture or analysis. It usually picks up signs of EHBDO within about 72 hours of a blockage starting.
That sounds pretty definitive. Any pitfalls with ultrasound? One key caution. Just seeing sludge in the gallbladder on ultrasound isn't automatically a problem. Fasting animals, or those not eating well, often develop sludge naturally. You can't assume it means obstruction without other signs, like dilated ducts. Also, sometimes gas in the intestines can obscure the view of the lower bile ducts, making stones there hard to see. And for stones in the liver, hepatobiliary, you might see an acoustic shadow behind them.
Good points. Anything else diagnostically?
Yes, if surgery is performed, getting a biopsy of the liver for histopathology, looking at the tissue under a microscope, is really crucial. It helps identify any underlying liver disease that might be contributing or needs separate treatment.
Okay, so a thorough workup. Now we've found them. What next? Treatment strategies. Is it always surgery?
Not necessarily, and that's where some debate comes in. If gallstones are found incidentally, say on an ultrasound for something else, and the animal has zero symptoms and normal lab work, it's controversial whether to immediately start treatment with drugs like ursodeoxycholic acid just to try and dissolve them or prevent problems.
Okay, so watchful waiting might be an option for asymptomatic cases.
It can be, yes, with monitoring. But for animals that are sick and hospitalized, the first step is supportive care, IV fluids, to correct dehydration, electrolyte imbalances, that sort of thing.
Stabilize them first.
Absolutely. And if hyperlipidemia, those high blood fats, is found, then a fat-restricted diet is important, plus looking for and treating any underlying cause like an endocrine disorder, Cushing's, hypothyroidism.
Address the root cause if possible.
Exactly. And control other predisposing factors, treat infections with antibiotics based on culture, ideally, and address that gallbladder dysmotility, the poor contraction. Sometimes that actually requires removing the gallbladder, a cholecystectomy, if it's causing chronic stasis and problems.
So surgery is on the table for symptomatic or complicated cases.
Yes, definitely. For symptomatic animals, especially with obstruction or severe inflammation, surgery is often needed. This might involve an exploratory surgery, opening the common bile duct, choledochotomy, or the gallbladder, cholecystotomy, to remove stones. Sometimes the gallbladder is removed entirely, cholecystectomy. In complex cases, a biliary enteric anastomosis might be needed, basically rerouting the bile flow into the intestine.
Okay. And is that usually curative?
That's the crucial thing to communicate to owners. Cholelithiasis can be a chronic, recurring problem. Even after successful surgery, stones can unfortunately reform over time, sometimes despite ongoing medical management.
Right, so it might be a long-term management situation. What about medications? What's in the toolkit?
Antibiotics are key, especially if infection is suspected or confirmed. Ideally, you choose based on culture results from bile or tissue. But often, you start with broad-spectrum antibiotics that cover common gut bacteria while waiting for results.
Makes sense. What else?
Ursodeoxycholic acid, or URSO, is a mainstay. It's got several benefits. It helps promote bile flow. It's a choleretic. It's thought to be liver protective, maybe has some anti-inflammatory effects, anti-fibrotic effects. And it might help dissolve certain types of stones, though that's less predictable.
So a multi-purpose drug.
Pretty much. If no underlying cause is found or fixed, vets often recommend long-term therapy with URSO. It's usually given orally, twice a day, with food.
Any catches with URSO?
Yes, a very important one. It should not be used if there's a complete extrahepatic bile duct obstruction, EHBDO. You need to relieve the blockage first, often surgically before starting URSO. Trying to force more bile flow against a total blockage is dangerous.
Okay, critical point. Other medications?
We mentioned vitamin K1 for jaundiced patients with prolonged clotting times, usually given as a few injections, subcutaneous or intramuscular, not IV due to allergy risks.
Right.
And antioxidants can be supportive. Vitamin E is often used if there are high liver enzymes or liver biliary inflammation. Doses vary, maybe 100, 400 IU per day. And S-adenosylmethionine, same, it's another antioxidant, acts as a precursor to glutathione, which is vital for liver health and also helps drive bile flow. Same might also have some choleretic, anti-fibrotic, and anti-inflammatory effects itself. Often given if liver enzymes are high or there's inflammation, it comes as an enteric-coated tablet, usually given on an empty stomach, maybe 18-20 milligrams per kilograms daily.
So a combination approach, infection control, bile flow promotion, liver support. What does follow-up look like after diagnosis or treatment?
If surgery was done, you need close monitoring initially. Regular checkups, repeating blood work maybe every 2-4 weeks until things normalize, and periodic ultrasounds are really important long term.
Why the repeat ultrasounds?
To check for any recurrence of stones, make sure the biliary tract looks okay, monitor the liver texture, basically keep an eye on things given the potential for recurrence.
Makes sense. And what are the really serious red flags or complications owners need to watch out for?
The big ones are signs suggesting bile leakage and infection spreading. So, a sudden onset of fever, severe abdominal pain, the pet becoming really lethargic or unwell, that could mean bile peritonitis and/or sepsis, which are emergencies.
Okay, urgent veterinary attention needed there. Any other complications?
Another possibility is a stone getting stuck again, maybe recurring obstruction right at the exit point into the intestine, the sphincter of Oddi. That would cause symptoms to return.
Right, back to square one potentially. So wrapping up, what's the overall expected course? The prognosis?
Well, like we've said, it can be completely silent and never cause an issue in some animals. If it does become symptomatic, the outlook really depends on what's going on underneath. Is there infection? How bad is the obstruction? Is there severe gallbladder inflammation? Did bile peritonitis develop? Those factors dictate the prognosis.
So to sum up this deep dive, it's clear cholelithiasis in dogs and cats is, well, it's complicated. Lots of different causes, different ways it shows up, different ways to tackle it.
Absolutely. And early detection, plus really digging into and addressing those underlying risk factors, the diet, the potential infections, the motility issues, seems absolutely key.
It really highlights how important working closely with your vet is, using those diagnostic tools like ultrasound to get the right picture and the right management plan.
Couldn't agree more. It's very individualized.
And just to leave you with something to think about, we talked about different stone compositions, calcium carbonate, bilirubin pigments, and various risk factors like diet, breed, cat anatomy. What other, maybe seemingly unrelated parts of a pet's health or even their environment might be playing a subtle role in whether these stones form? Something to chew on. Thanks for joining us on this deep dive.